Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We're doing an extra edition here of Facebook Live, your opportunity to ask questions, because we are just hearing so much excitement, but also questions about the COVID-19 vaccine. Also, with this being, of course, a week with a lot of holidays and a lot of events going on, we may not be on our regular days. So thank you to those of you who have joined. Today is Monday, December 21st, 2020. As always, we will be really giving you an update on what is happening with COVID here in Chicago, and then answering a lot of questions from you about especially vaccine, but you can continue to put other questions in, but that's going to be our primary focus. As always, you can put your questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter, and we will be answering your questions live. So first, let's dive in and take a look at what our numbers for COVID are looking like here in Chicago. As always, you go to chicago.gov/coronavirus. Right up at the top under latest data, the first tab down is the data dashboard. You'll note that there is now also at the bottom of that latest data, we've got a vaccine data tab, so we'll show that too. So let's go ahead and pull up the dashboard. You can also get there directly by chi.gov/COVID-. And on the landing page first, do we have it up? Great. We can see that our positivity is at 11.5%. And if we look at the graph on the right, we're doing better here. Now remember, we want to be down below 5% ideally, so we still have a long way to go. But you can see our peak here back in mid-November was up as high as about 16%. We'd gotten down to 11.4, 11.5% right prior to Thanksgiving. We did see this little surge with Thanksgiving, but now we're coming back down again nicely. So some good progress there. We're averaging a little bit under 14,000 tests a day, and our daily case average is at just over 1,300 cases. Again, if we look at the cases on the daily dashboard here, these were coming down since mid-November very nicely. We saw this uptick with Thanksgiving, but now come back down. We're just down again. This is the lowest now in terms of new average case numbers that we've seen in this second surge. So I really, really want to see our improvement continue like this. Remember, our goal is to be ideally less than 400 cases and ideally less than 5% positivity. We still have a long way to go, but heading in the right direction for sure. You can help with this by really being careful with your holiday gatherings, whether that's Hanukkah or Christmas or Kwanzaa or any of the other end-of-year celebrations that we see. This is a time where we still have a lot of COVID in Chicago, high risk in terms of gathering, and would ask you not to conflate the really exciting news that we're starting with vaccine with thinking that we can back off on a lot of the masking and social distancing, washing of hands, and importantly, not gathering. So we do continue under the stay-at-home advisory here that has been extended into early January. And in that context, would ask you, please, if you can avoid going out, unless it's for work or for school or for really essential reasons, please do. Try not to have people over into the home that don't live there, unless, again, it's an essential reason. Obviously, if you have people coming in to help with health or help with education or other essential reasons, that's fine. Just be careful. But please, please keep the gathering over this holiday season to a minimum. And ideally, just be gathering with your immediate family. Deaths continue at 18 a day. That also looks like it may have peaked. You can see last week we were averaging as many as 24 a day. This is still a lot. We were averaging 2 to 3 a day over the summer, but our hospital numbers just starting to downtrend, our deaths just starting to downtrend. I want that to continue sort of as we get through December and into January, and not to see a big spike. Ideally, Thanksgiving certainly could have been worse, but we did see some increase here, and would ask really at a city level as much as possible. We want to start moving the dial on reopening things as we're able to in January. Okay, let's look quickly though, because I know a lot of you are interested in vaccine data. So you can see under latest data here, in addition to our daily dashboard, which is what we looked at, if you're not used to coronavirus at a glance, this is where every day we're updating with explanatory language, things like hospital capacity. It's kind of a high level with some more explanation behind it, what's happening with COVID. Here's the detailed daily hospital capacity. Data reports is where you can get in and find out a lot of more detailed data. Depending on what your interests are, our reopening metrics, our mobility reports, our data portal, which is where you can download the data if you want to explore it and map it yourself. Presentations are like what we do at press conferences, things that we're putting out publicly. Doubling time is relevant particularly for the CPS conversation, as that's the thing that we've really pegged reopening there too. And then right at the bottom here, a vaccine data update. Let's look at it. So this is going to continue to expand. Right now we just have number of doses. And you can see that this really goes through Saturday, the 19th. And we had 8,384 doses that had been administered as of Saturday. After these are administered, providers have 24 hours to put in the data related to who they have vaccinated. And then there can be, again, we're pulling data down out of the state registry about once a day. So this will be getting updated daily. And in the days to come, you will see much more interactive opportunities here. So as more data is flowing through, we plan to show this. And in fact, in the data portal, you can already start to see the zip codes where people live. We do plan to share age and race ethnicity data. We plan to talk about the percentage of groups that have been reached. There will be much, much more coming on this as data is flowing to share. But here at the highest level, you can see we started our very first vaccine arrived here a week ago today in Chicago. And within 24 hours, we started vaccinating. That first day, if you look on the data portal portion, we just started with a very few vaccinations and then really seeing increase from there. And we expect to continue to see that growing significantly. Now, last week in Chicago, every week, the city of Chicago is allocated a certain number of doses of vaccine. We only know what that number is just a little bit before the upcoming week. So we were allocated 23,400 doses of the Pfizer vaccine, and we received 23,400 doses. Most of those went out to our hospitals, and they arrived over the week. So some hospitals, many hospitals actually received their first doses on Thursday. We don't have control over when it arrives within the week, but it arrives within that week. And so most of the doses went directly to a lot of our larger hospitals. A lot of our smaller hospitals, CDPH was distributing vaccine. Every hospital, all 34 or 35 of our hospitals here in Chicago that requested vaccine in the first week did receive it. And there were just a handful that were starting this week instead. And so they're really starting today. So we had a very, very successful really getting vaccine out to all hospitals within that first week of vaccine distribution. And this second week, we again are first and foremost focused on hospitals. We're getting another 16,575 doses of the Pfizer vaccine this week. And those are again really aimed for hospitals. So a lot of the larger hospitals should directly be receiving vaccine. We're expecting that today, possibly tomorrow. Again, we don't control exactly when it's shipped from the manufacturer, but are expecting it really early this week. And so that means that our largest hospitals here in Chicago each received about should have received almost 4,000 doses actually within approximately the first week of vaccination starting, which is good. And then it goes down from there based on number of beds. But we continue to provide vaccine week after week after week for as long as hospitals need it. So that all really went very, very well. I think the other thing, and we'll get into questions in just a second, but I wanted to set this up because I know already even in the questions that were coming in, lots of questions about distribution. So as a reminder, we are focused first and foremost on our in phase 1A here, which is set by the federal government. The Advisory Committee on Immunization Practices and the CDC defined phase 1A as healthcare workers and long-term care facility residents. And that means that, for at least the first month here in Chicago, that is our focus. So just like this week we're adding on hospitals, the Moderna vaccine, of course, was the other exciting news really over the last week and weekend. The FDA granted the emergency use authorization. The Advisory Committee on Immunization Practices with CDC also met, gave the recommendation for use. And so that vaccine is also being allocated to Chicago. A little more than 46,000 doses really in the first week, so that's a lot. Most of that Moderna vaccine is going to long-term care facilities, and so it's being allocated this week, and it will largely start to be administered starting next week. We're doing that with pharmacy partners in long-term care facilities, all 128 of our skilled nursing facilities and assisted living. So that is ramping up really over, this vaccine will start to get here, and we plan to start next week here in Chicago. And then similarly, we're really excited that we will be starting to think about outpatient providers here. So hospitals will continue to receive vaccine. We will keep giving vaccine to hospitals as long as they have staff to vaccinate, and we'll be encouraging hospitals to be partnering with their outpatient partners and other to continue to be able to vaccinate through hospitals. But in addition, for those that are not connected to hospitals, some of the larger outpatient facilities, we will be distributing some vaccine directly to those providers. So that would be especially some of the larger clinics, for example, but we're not just thinking clinics. As we sort of move ahead here, this includes dentists, this includes morticians, this includes home health care workers, really the range of people who are doing health care in a variety of settings. And so one of the exciting things is that the Moderna vaccine is not as complicated from a storage perspective. So where the Pfizer vaccine has the ultra cold and there's special freezers that are needed there, and you have to use the vaccine within 5 days of when it comes out of those special freezers. You can't move it in and out. The Moderna vaccine just requires more of a regular freezer, and so that is much easier for outpatient settings to be able to handle. How quickly we're able to do this is mostly about how quickly vaccine ramps up at the national level. We have excellent systems in place here to be able to push it out. We've thought a lot about equity, we've thought a lot about access, and it's looking at who can handle the ultra cold versus the regular and continuing to build from there. So next week is going to be a really exciting week. Long-term care is going to kick off. Outpatient facilities broadly will start. We're going to start kind of pulling them in, start doing some distribution, really just over the next kind of few days to week. And then for people who are working in smaller settings, if they're not in a larger clinic, that's where we'll start pulling them into some of the larger, what's called a point of dispensing, a mass vaccination clinic. And some of that is also kicking off next week. So all kinds of work happening related to pushing vaccine out in Chicago. One thing I wanted to highlight is that our numbers on the dashboard here will only reflect Chicago residents who are vaccinated, even though we have made a commitment that we will vaccinate when we're in workplace settings, of course, and other settings. We are vaccinating lots of non-Chicago residents. So where there are non-Chicago residents who work at one of our hospitals, for example, they're all being vaccinated here. They are still counted, obviously, within the registry and in the system, but we report out on the Chicago residents who we vaccinate. So that's one reason why you won't see an exact one-to-one match, but it will all be collected and all be reported out, and we do plan to sort of look at what's happening in suburban Cook County, even in some of our dashboards. So much more to come, but I was very, very pleased with how our first week of vaccine distribution and just seeing the excitement, the demand for this vaccine. My Facebook feed, of course, is full of doctors and nurses and providers, people I trained with across the country, friends, and just seeing all of the people who are, who have been on the front lines really starting to celebrate this vaccine and posting pictures of themselves and why they're getting vaccinated. Really positive rollout here. Okay, so let's turn and get into some questions. Okay, so there's a lot of questions here about lots of things. Okay, so lots of questions about just what's in the coronavirus vaccine. I'm pulling together, some people want to know what is in it, what isn't in it. Let's talk about that just kind of high level. So first, both of these first two vaccines, the only active ingredient in them is the mRNA, the messenger RNA, which we've talked about previously, is the little snippet of the instructions that the messenger RNA that teach your cell to protect you against COVID. There are not other active ingredients in the coronavirus vaccine. So like if we look at the Pfizer one, for example, in addition to the little snippet of the mRNA, the rest of the ingredients in there are just meant to protect that mRNA and ensure that it can get into the cell. So there are 4 different fats, like lipids, that are in this vaccine, and they range from, one is actually just cholesterol, one is something called PEG, polyethylene glycol, which is used very, very often for medical procedures, but 4 fats, those just help stabilize the mRNA. There are also 4 different salts in there. That's just to make sure that the vaccine is the right pH and that it interacts right with your cells. So that includes, again, basic things like potassium chloride, sodium chloride, that's the same thing as table salt. And then the only other ingredient in there is sucrose, which is sugar, like table sugar, basically. That's just to help keep the fat globules from sticking to each other, sticking to the vial, and that's it. So in terms of what is not in this vaccine, because I'm going to try to hit off a lot of these questions. So first and foremost, there are no preservatives in this vaccine. That's part of why the ultra cold is needed, et cetera. But this is because it doesn't use a live virus. You don't need to have antibiotics in there. So no antibiotics, no preservatives, no thimerosal, no mercury, no preservatives of any kind. There also are no fetal cells or anything related to fetal cells. There is no DNA. There are no proteins in this at all, which means there are no concerns with egg allergies. There's no egg or sort of other protein. There is no gluten or concern for people with gluten sensitivity. There are no blood products. Are no pork products. There are no microchips. And if there are other questions people have, please put them in the box. But what there are, 1 active ingredient, messenger RNA, 4 fats to stabilize it, 4 salts to make sure it's the right pH, and 1 sugar. So I've also seen some questions. Okay, there's Michelle Heller, for example, on Facebook. How do people have allergic reactions? So first, there's been a lot of attention on some of these allergic reactions, and I want to put them in a little bit of context. On the CDC website, just like here in Chicago, we're tracking how many vaccine doses in Chicago residents. They're tracking, Chicago, when people get vaccinated in Chicago, it gets reported into the state registry, and then the state is giving up to the CDC how many people have been vaccinated, and so they're keeping track of it nationally. There are more than 500,000 people already vaccinated with COVID here in the US in the first week, which is great. And so in that 500,000 people, there were just a handful of people who had these allergic reactions and a lot of attention. That's really not unexpected in terms of a vaccine. Most likely, where people are having an allergic reaction, they're having it to one of the lipids, one of the fats. So, for example, I was reading over the weekend the PEG, the polyethylene glycol. It is known that there can be people who have a reaction to that. Sometimes there's contrast that you'll use, or for if you've ever had a gastrointestinal study, it's known that occasionally people can have an allergy to that, and that's probably where some of these folks have had allergies, what that is too. The people who have had the allergies, they've had to get the treatment for it, but we are always set up whenever we give vaccines to be able to treat people who have an allergic reaction. They've recovered, and compared to the 500,000 plus that have gotten it, to have seen a few allergic reactions, not unexpected, not anything that gives me pause, but there's work going on to understand what component that allergy may have been to. Okay, we also are getting Okay, so Blanca Dove on Facebook is asking, have I gotten the vaccine? Not yet. And there's another couple questions here. Has the mayor gotten the vaccine? When is the governor getting the vaccine? So we are really sticking here to the prioritization. Again, we have to follow at a high level, the federal ACIP prioritization. 1A is for healthcare workers and long-term care facility residents. So and then even within that, we prioritize related to risk of COVID exposure. So we started here with hospital-based workers. I intend to get the vaccine just as soon as here in Chicago, we are moving into outpatient healthcare workers. I am guessing that may be potentially as soon as early next week. So more to come. I definitely will do that publicly. But we really do want to highlight, I do see patients on a volunteer basis at our largest free clinic here in Chicago, and I want to get the vaccine, really when it's my turn. And so I'll be getting it, I expect certainly before the end of the year, probably next week. But we'll use it to really highlight that we're moving into outpatient providers. Similarly, the mayor is all excited about getting the vaccine when it is her turn. She doesn't want to jump the line in front of healthcare workers. So that is why you are seeing those decisions that we make. We do absolutely plan to get those publicly, and I'm really looking forward to getting it, but I also don't want to jump the line in front of hospital-based providers. Okay. A couple of questions. Okay, Maria Espinoza on Facebook, are home health nurses part of the first phase eligibility as well? Yes. Phase 1A is healthcare workers broadly. So like I was saying at the beginning, we're starting with hospitals, we'll be moving sort of into outpatient. There's something like 400,000 healthcare workers if you take the very broad view. And so the health department, we reached out to, starting again with a lot of the outpatient clinics, places where they're doing a lot of COVID testing, really seeing a lot of COVID patients. They again take some higher priority. There will both be vaccine being delivered directly to some of those clinics, only to vaccinate their staff. We're not vaccinating patients yet. And there will be additional outreach, including to home health nurses and home health workers. We've actually already started that conversation. We've been in some conversation with, for example, SEIU, which is the union that represents about 90,000 of our healthcare workers here in Chicago. A lot of the long-term care facility workers, a lot of the home health workers. We really want to partner here around making sure people are getting their questions answered, and then we'll be working. Either people will be able to get vaccine through a hospital if they're partnered there, potentially through a clinic setting, or through some of our initial large points of dispensing. Those points of dispensing are mass vaccination clinics in phase 1A, only for healthcare workers, only by appointment. So that's where some of the home health nurses will plug in. That's not tomorrow, that's more of a January. But yes, absolutely, they're in 1A, and we're really, really interested in making sure they get vaccinated, because especially if they're working in different homes, right? Like this is where, and they're working with people who are vulnerable, you really want to make sure that they are themselves getting vaccinated. Okay. Now, some questions here about kind of what's next. I see CPS parents on Twitter asking what month, best guess is fine, will teachers get vaccinated, and similar questions around that. So just yesterday, again, the ACIP, the CDC group that we have to follow, they did vote on what's next in terms of phases. So we were really pleased that that happened. The CDC will probably formally accept those recommendations today. Tomorrow it will come out in writing, likely, the exact details of this, but at a high level. So in these phases that are happening all over the country, we're thinking about two things. Number one, how do we help prevent what's called morbidity and mortality, the severe outcomes from COVID, people who are at highest risk for getting hospitalized or for dying. So we want to prioritize people with that risk over here, and then we want to prioritize the people who are really necessary for the functioning of society and who have a lot of public contact, because that's a way to help decrease infection. So it's balancing the morbidity and mortality, the high risk for severe outcomes, against the public-facing functioning of society and cutting down on infection. So we think about those together. So for example, in phase 1A, in the category of highest risk for severe outcomes and wanting to think about keeping hospitalizations and deaths down, long-term care facility residents came in there. In terms of highest priority for societal functioning, limit risk of infection, that's where all of our healthcare workers came in. That was 1A. That's already been announced. Next, what ACIP is saying, phase 1B is going to include, on the side of thinking about who is the most likely to get seriously ill, hospitalized, or to die, prioritizing people who are 75 years and older. So we plan to adopt that here in Chicago. Once we get past this 1A phase, healthcare workers and long-term care, this is more than a month away. This is probably February, maybe late February. We'll see. It all depends on how vaccine comes through. But as we move to the next phase, we'll be looking for people who are over 75 or older. Doesn't matter if you have underlying conditions. Just 75 or older will be on that prioritization side. And then on the societal function and infection side, it will be frontline essential workers. And the ACIP is defining that some more, which we were pleased about here in Chicago. At the highest level, and again, there will be more details coming, that includes our first responders, like police and fire. That includes teachers and other educator staff, to the specific question, and daycare staff. It includes food, grocery stores, and manufacturing workers. It includes correctional workers, postal workers, public transit workers. So again, people who are very much in public-facing roles within that essential worker piece. So there will be more detail coming about that. But here in Chicago and around the country, once we move from healthcare workers and long-term care, we expect to have a focus on people over 75 and then people in these frontline essential worker categories. And you're going to hear a lot more about what that looks like. We plan on the people who are over 75, we'll want to really be encouraging those folks as much as possible to be getting vaccinated through their providers. So part of the goal of us getting vaccine out to clinics right now is they'll start with their staff, but then they'll be in the system, they'll have their training, they'll have done their registry at the state level to report, to be able to start vaccinating those people who are over 75, as well as potentially some of these frontline workers. And then we will definitely be pairing some of these larger employers, grocery stores, for example, or CTA, or CPS, or other schools, et cetera, really thinking about how we make sure vaccine is available in workplace type settings paired with vaccinators to be able to make vaccine available. So to the original question about exactly when will teachers get it, all I can say is it will be in the next phase. My guess is that will be probably, maybe that will start in kind of a February to March, like late in probably this first quarter. I don't want to put an exact month on it, but it's next with a lot of these other groups. So that's exciting. We are definitely not waiting to begin vaccination to be bringing students back, assuming that the doubling time continues to look good. We've seen absolutely around the country and around the world that as long as your protocols are in place, that is safe to do. So we continue to look at this point, starting in January, bringing back some of the pre-K and the special needs students, and then moving more toward other elementary and younger students kind of in February. But yes, I think this spring is going to be about vaccinating essential workers, and teachers and educational staff are very much in there. So more to come there. Just to sort of round that conversation out, because I'm seeing some other questions about what's next. And I know I'm talking a lot here as opposed to getting through questions, but I can see all the things that are coming in, and I think it helps set it. After 1B, the next level, the 1C prioritization, which is probably later in the spring, would be people between the ages of 65 and 74, people of all ages except children who have underlying conditions. That's in terms of who's at higher risk of getting seriously ill, paired with the rest of the essential workers. So that will probably be our 1C, our next prioritization group. That's months away. And then likely after that, the hope is that really by summer, give or take, there will be enough vaccine that we won't need priority groups anymore, and it will be open to all. Children, of course, the trials need to be finished so that before we'll be vaccinating children. I don't anticipate that until summer at the earliest. So more to come there, but that at a high level will be what will happen. Stephen Mitchell on Facebook, I think on the follow-up to CPS, is asking, what is the infection rate being used to determine whether it's safe for CPS students to return to school? So that's where we're following that doubling time. As long as the outbreak continues to be broadly coming under control here, which it is, and that doubling time is at least 18 days, which it is much more than 18 days right now, we do plan to start moving ahead. And that's consistent with what we're really what the national conversation is there. So we can talk more about that in the future. Okay, number of questions about the new strain. Joshua Juke on Facebook and others asking, what about this new strain in the UK? Does it still have the crown? Another, will this strain be worse? Will the vaccine help? All right, so here's what I can tell you about this strain conversation coming out of the UK. So the UK, and particularly London, has had a big surge of infections, like really big, just in the last week or two. And where they've been looking at some of the genetic analysis, they've identified that one of the, it's not really a full strain. The media is kind of using that term, but there have been some mutations seen that they are hypothesizing could be leading to some more risk of spread. There's been no sign that this quote unquote strain leads to more severe outcomes, that people are more likely to be hospitalized, more likely to die. Importantly, there's also no sign that this strain would in any way that the vaccine would not be effective against it. So it still has the same crown, it still has the same spikes. There's not major changes in a way that we would anticipate the vaccine would not be effective. And I think honestly the jury is still out in terms of how much this particular subtype of COVID is contributing to the increased spread versus just some of the behavioral things that in the UK they are seeing with holiday times, as we may see here too. So certainly we're watching it closely, but it did not give me major pause. It does not in any way affect us here in Chicago related to our planning, how the vaccine is behaving here, how the virus is behaving here. And importantly, nothing about this at this point is concerning from a vaccine protection standpoint. Don Bransford from Facebook, given the current stats, how are you saying we missed a Thanksgiving surge? I am not saying we missed a Thanksgiving surge. There's been a lot on, I don't know why, you're not the only one who's been asking this question. So I think broadly, we saw a lot of people here stay home for Thanksgiving, and there's been some interesting stats about, here in Chicago in particular, compared to the rest of the state and, to an extent the rest of the country. We did see a pretty significant decrease in gathering compared to prior years, and I want to thank you all for that. Even with that, we did see a bump. We saw there were some changes in testing numbers here, which certainly play into this, but we saw a real uptick in positivity exactly at the time that you would expect post-Thanksgiving, and we saw a real uptick in cases that we are only just now sort of coming back down from. So, bottom line is yes, we definitely saw some impact from Thanksgiving here in Chicago. Thank everybody who helped to make sure that this didn't turn into something worse, where we didn't see major impacts in terms of hospitalizations, deaths. You look at California, I don't know how much people have been following this nationally. While Chicago and Illinois are sort of gently on a decline here, with that little, we saw some bump of Thanksgiving, but we are now back on the decline. The Los Angeles area is like out of hospital beds, seriously. Like they have 1%, 0%, negative 1% hospital bed availability, whereas we're sitting here, around the 20%. 20% is still not great, but we haven't seen flu hit either. That's been some really good news here locally. So thank you to everybody who's gotten their flu vaccines. All of the masking so far has been very, very good in terms of flu numbers. So we've not seen our hospitals get hard hit by flu yet, and that has let us be able to handle, the thousands of people that are in the hospitals related to COVID. A quarter of our hospital beds, of our ICU beds, are being taken up by COVID patients, but we're able to handle it because numbers are on the decline. But, I can't say strongly enough that these next couple of weeks are going to be a little bit dependent on whether people make some of the harder decisions around gathering related to Christmas. You know, normally I would be going to Michigan. I love the end of the year. It's normally a major gathering time for my extended family. And, you know, I live by myself. I'm going to be home, like, by myself for, you know, I celebrate Christmas, and I don't love that, but it is the right decision for me, my family, and for Chicago. I'll be Zooming. We did, you know, a lot of us have the same Christmas dishes, and we did a virtual, you know, tea with the Christmas dishes, and, you know, I'm ordering in some special food, and, you know, I'm doing things to try to be somewhat celebratory. I'm also very busy with vaccine planning, so for me, there's a lot of distraction there. But it is not the time, again, to be getting together with large extended families. We still have a very high risk for COVID here. I wish we didn't, but we do, and I really want to continue to see the improvements. I want nothing more than in January to be able to start dialing back, ideally, some of those limits. But, you know, sitting at a almost 12% positivity is no good. Like, we've got to get that, you know, about in half before we can start at the state level, you know, being able to think about reopening some other activities. So the next few weeks, we'll learn a lot about what comes. All right. We're just about at time. Let me maybe run through one or two quickly. Mary Hidalgo on Facebook. Can I ask about the RNA? There's fear on the questions about the change of DNA of a person taking the vaccine. Excellent question. There is no DNA in this vaccine, and the messenger RNA does not interact with your DNA in any way. Your DNA lives in the nucleus of your cell. The messenger RNA never gets into the nucleus of your cell. It stays in the cytoplasm of the cell, which is outside where the DNA lives. It's just helping your body learn to make the protein, a little piece of basically the spike, so your immune system can learn to recognize COVID and fight it off without making you sick. So in my long list of no's, no DNA and no interaction with your own DNA. Related question here of how long does that mRNA last? You know, it lasts, without the lipids, the fats around it, it lasts on the order of hours. With the lipids around it, it lasts at the most on the order of a few days. And so this does not hang around for months. We saw some questions about, you know, there's no link here to infertility. There's no link to, there was some early speculation that there could be some problems with the placenta and how that there's a part of the coronavirus spike that sort of looks like part of the placenta. No, like, none of this has really borne out. And if you do have more specific questions, we can get into some more details at the next time. But what I read you at the beginning is what is in this vaccine, and there is no interaction with your DNA. Okay. Maybe just the last one for today, Ross Redbone on Facebook. Is there a vaccine pretest for those with severe food and drug reactions? There is not. If you have a history of severe food and drug reactions, again, with the components that are in this vaccine, we would not think about you having, most likely, a severe reaction to this vaccine. The only people who are being recommended not to get the vaccine are people who are known to have, you know, a severe allergy to one of these components, like, for example, the PEG, the fat that can have it. But if you have an allergy that's bad enough that you have to carry an EpiPen, I would encourage you to have a conversation with your doctor about this. But where my friends are asking me, even if they have histories of food allergies, et cetera, generally I think that the vaccine is still recommended. But please have a conversation with your doctor, and that would be true for anybody who's got specific questions about themselves. Okay. So we're about at time. I know we couldn't get through so many questions, but I wanted to hit at a high level some of what's happening with vaccine planning. Things are going very, very well in Chicago from a logistics standpoint, in terms of getting this vaccine out far and wide with an attention toward equity. There's going to be more and more and more vaccine available every week. And the more that you can educate yourself, and also, you know, if you work with organizations and you're really thinking about, you know, when can I get the vaccine? We absolutely have a goal that every Chicagoan will be able to get this vaccine in 2021 at no cost to them. But while vaccine supply remains limited, we do need to prioritize around, these two factors like I laid out. So we have not forgotten about groups. There will be a lot more coming. But what you can do right now is work with your group to build confidence in this vaccine. I encourage you to check out the website, chi.gov/COVIDvax will take you directly there, or off chicago.gov/coronavirus. Right at the top, the vaccine tab. There is a lot of information in there. It's particularly under downloads. We've got information in all of the top Chicago languages. We've got pages and pages of frequently asked questions, message mapping that is being updated every week. You are welcome to take anything off that page, rebrand it, post it on your own social media. Do post your questions. Do make sure that you're getting good information. The CDC also, of course, is posting a lot of information, trusted site there. But we're doing everything we can to get a lot of information up to make sure Chicagoans understand how vaccine rollout is happening here in Chicago and answer your questions about the local rollout. But I've been very pleased with how this is going and really looking forward to week after week seeing those numbers continue to increase. So really, my good news for the week is just that vaccine is still continuing to come. Having a second vaccine available, especially one that doesn't have as much of the really complicated logistics behind it, is really good news in terms of thinking positively about the end of the year. I think just looking ahead, tomorrow the Surgeon General is actually expected to be in town, and we are planning, he's really interested in seeing what some of the Chicago vaccine distribution looks like, and we're expecting at this point to probably have a press conference in the afternoon that I'll be at, Dr. Ezike will be at. We'll be talking about how city and state vaccine fit together, probably with the Surgeon General. So looking forward to that, and you can watch for that. I don't know that we will necessarily do another one of these Facebook lives this week. We'll see how things develop here, but we continue to record a lot of the frequently asked questions. I've been putting some videos together about science behind the vaccine. So watch your social media, and please do continue to share your own stories. If you're a healthcare worker and you've been lucky enough to already be vaccinated here in Chicago, I love it when you are posting your pictures, your stories. People have been doing really well. We've obviously been following up on the side effects, and most people said, yeah, maybe I had a sore arm for a day. We had a few people certainly who said, I felt a little under the weather, fatigued for a day or two. But by and large, this has just been a really positive rollout, and I'm really excited because this is how we're going to get out of this. So really happy holidays to everybody. If we don't see you on Facebook Live again this week, we'll be back in force next week and posting more social media in the days to come. So please spread joy, not COVID, this holiday season, and be careful. Keep doing the things that work. And we will see you probably next week. Happy holidays.